Hello viewers, welcome to HCC Coding channel. In previous video we have covered what is ICD-10-CM, what it includes, what are the different chapters we are having, everything we have covered. And today we'll discuss the most important topic in ICD-10-CM manual, that is nothing but conventions. We'll see introduction to conventions. First, we'll see what is the definition of conventions. Then, after subcategories of like alphabetical index and tabular list, format and structure, placeholder character, seventh character, NEC and NOS, and punctuations. This is just part one. We will cover part two in the next video. So this is just only the half amount or half content of the conventions. Now coming to conventions definition. In medical coding, conventions refers to standardized rules, guidelines which provides the framework for coders to ensure what diagnoses and procedures are reported correctly and consistently across the healthcare system. I can tell you in a very simple way, these are the standardized rules. What is that? Conventions. Conventions are the standardized rules or guidelines that help coders to select the appropriate code for the diagnosis. This is about conventions. And coming to the guidelines, whatever that included in the conventions, the first thing we will be seeing about what is mean by this alphabetical index and what is mean by this tabular list. We'll see. Alphabetical index. This alphabetical index helps in leading a code, and tabular list helps in confirmation and completeness of code. How can we do this? I'll explain through a video. Okay. This is an ICD-10-CM. You can see this. This is a manual which is of 2023 year. Okay, but for every year it will be getting updated. So every year you'll be getting an updated codes. I have told that in our introduction to ICD-10-CM part. So I'll show you what is alphabetical index here. You can see this alphabetical index where and condition starts from a category. How we will be leading a code through this, like same as dictionary. In our dictionary, how we will be finding a word by using an alphabets. If it is related to A alphabet, we'll search under A alphabet. If it is relates to B alphabet or C alphabet, according to that we will search a diagnosis. The same way, like alphabetical index will starts with a category of a diagnosis. Here we can see like an abdomen condition we are having, or aberrant condition we are having, and you can see here abnormality. You can see here all these are different conditions which relates to a character, and we are having different alphabet characters also. I'll be showing that, like if you want to see any conditions related to D alphabet, see all D alphabet related codes, you can find this all starts with a D. Under D, all these comes under has a specification. So this is an alphabetical index where we will be leading a code by using an alphabetical index. For example, if I am leading any condition, I will be taking example as diabetes. So diabetes, if I see this, you can see the diabetes. Able to see this? I hope so, right? I'll show the proper diabetes point. Yes. Here you can see the word diabetes. Yes, it is a D alphabet, and diabetes code we are having. For diabetes, we got a code called 11.9. This we have let a code in alphabetical index. Now I'll confirm by opening this particular code in a tabular list, whether it is giving a description of same diabetes mellitus or not. So I'll open the C11.9. We'll see here. So the next topic is format and structure. How a code will be designed, in what format, in what structure, that points we will be seeing here. The ICD-10-CM code format is used to classify diagnosis and conditions. These codes are alphanumeric and can range from 3 to 7 characters in length. The structure is designed to allow coders to select the most precise code based on the clinical documentation. In a simple way, what they are mentioning here, a code starts with an alphabetical word, or we will be calling together it has an alpha numeric, which a code indicates alpha and a numeric, where a code starts from minimum of 3 characters a code starts and maximum of 7 characters of code length we will be having. And structure means we will use the most precise or most specified code based on the condition documented by a doctor. Okay, we'll see that format and structure examples here. We are having some general structure examples. The first character, we are aware of this letter A to Z indicating the chapter in the ICD-10-CM classification. First character will be indicating an alphabet, and coming to second and third characters, it might be from a number or a numeric 0 to 9 used to further specify the condition or disease within the chapter. And we are having the fourth to sixth characters. These provide additional specificity such as location, severity, or other features for a code. If your code is having also a seventh character, that seventh character that might be a numeric or that might be an alphabet, that will be indicating based on the encounter or specification we can tell. Based on the status of the encounter or based on the specification of a condition, the seventh character will be decided. So all these comes under general structure of ICD-10-CM codes. We'll see examples for this. Here we are having one of the example, hypertension. You can see this, how many characters we are having for a hypertension. 3 characters we are having, I10. Total 3 characters is the minimum characters for a code. So I10 we are calling it has a essential hypertension, where it indicating the 3 characters. Here I alphabet relates to a circulatory system. Yes, hypertension relates to a circulatory system, right? So I alphabet will be indicating the system, that is here we are indicating it has a circulatory system, and at 10 it will be indicating the essential hypertension word. This is one of the example. And another example I took, it has a malignant neoplasm of right breast unspecified. Total 5 characters we are having here, you can count. Total 6 characters we are having here, C50.911. C will be indicating the neoplasms, and that comes in the chapter 2. And 50 will be indicating the malignant neoplasm of the breast. Breast specification will be means breast cancer or breast neoplasm will be indicating by the 50, and 911 will be indicating the specification of that breast cancer. Here what specification I have documented? Right breast specification I have documented. So that right breast will be indicated by last 3 characters. Right breast unspecified. So together we'll be calling it has a malignant neoplasm of right breast unspecified condition. So these are the examples we are having. Yes, and and just a general structure, code system which from which we will be using a code system from ICD-10-CM manual. What code type we will be choosing, that is nothing but diagnosis. How a code type structure will be designed, it is an alphanumeric, and how a code length we will be having from 3 to 7 characters of code we will be having. An example we have seen about the hypertension. And next we are having placeholder character. What is this placeholder character? We'll see. Placeholder character is used to allow for the proper expansion of codes and to meet the required code length for certain conditions. The placeholder character in ICD-10-CM is the letter X. The X is used in ICD-10-CM codes to fill in a space when a code requires a certain number of characters, but the full number of characters is not yet defined for that specific diagnosis or condition. For example, if a code requires to give it has a complete code, if a code requires 6 characters, and that 6 characters if it is not present in your book, so in that missing character, if it is might be sixth character is missing, so what I'll be doing, I'll be placing an X and I'll be completing the code. I'll show the examples here. I have written some of the examples like unspecified open angle glaucoma. I'll show you how these codes, why I have placed X in this particular character. I'll explain you through a video. We'll see that. So now coming to the example of placeholder character, I showed that, or I informed that I'll be showing this particular glaucoma code. You can see in the second column particularly we are having a word called glaucoma. If I am mentioning only glaucoma, we will be getting a different code H40.9. But what I have specified, open angle glaucoma I have specified. So under glaucoma, I need to search for the open angle word. Do we have that? Yes, you can see this. So this comes under glaucoma. Under glaucoma, you can find a word called open angle. What is the code they have mentioned here? H40.10. Beside a code, if you are having any tick mark symbol, this will be indicating as a incomplete code. So what I will be doing, I will be opening this particular code in a tabular list. Okay, now H40 point open angle glaucoma I have told, right? Under glaucoma, open angle I have seen has a subcategory. So I'll open this specification in the tabular list. Now you can find a word open angle glaucoma. You can see this, I hope so, right? Open angle glaucoma H40.10. Here you can see a small word called the fifth character. If it is asking beside a code any character, so this particular code requires a fifth character. So below to this I am having a fifth character code H40.10. So all these H4010, all these we are having 5 characters, and beside this 5 characters it is asking for the 7th character. Means this particular code will be indicating this, or this particular code will be considering it has a complete only if you are having a complete 7 characters. So what I will do, I am having only 5 characters, I require 2 more characters. So here if you see, one of the following 7th character is to be assigned to code H40.10 to designate the stage of the glaucoma. So for this particular H40.0, I can use the 7th character, only the 7th character from the below terms. Like if they are mentioning the stage, if they are not specifying any stage, then I'll be taking the 7th character has a 0. If they are mentioning open angle glaucoma has a mild stage, I'll be taking the 7th character has a 1, and moderate stage 2, severe stage 3, and intermediate stage it is 4. So if I am not documenting any stage, simply I have mentioned patient is having open angle glaucoma. So open angle glaucoma unspecified H40.10, and the 7th character I have placed it has a 0. So we got 5 characters we are having, and we got the 7th character also, but 1 character is missing here, that is nothing but the 6th character. So do we have any 6th terms here? Do we have any 6th term or 6th specification code we are having for this? No, we are not having the 6th specification. So in 6th character, I will be placing X. So I'll be completing the code as H40.10X0. So this is how I'll be completing the code. So you can see here I have shown in ICD-10-CM manual how we will be getting this particular code. The same way if they are specifying open angle glaucoma mild stage, then this is the specification code. So here yes, sixth character is missing. So in all specifications of open angle glaucoma, in sixth character I have placed the X. So this code we will be calling it as a complete code. Only complete codes you have to capture, not incomplete codes. So this is about placeholder character. And coming to the seventh character, here seventh character is used in certain codes to provide additional information about the encounter or the status of the condition. This is particularly important in coding for injuries, fractures, and certain other conditions, such as complications and some diseases. We'll see the examples. Usually, what type of characters will be indicating in the seventh character? Usually, it might be a numeric code can be indicated, or an alphabetical word it will be indicated in the seventh character. Here, if I take alphabetical indicator like A, if the code indicates the seventh character has an alphabetical word A we will be calling it as a initial encounter. What is mean by this initial encounter? Like for example, if a person is receiving an active treatment for the first time in the hospital, we will be calling it as a initial encounter. So you can see here, used when a patient is receiving active treatment for an injury or illness or condition. This would be the first time the patient is being treated for the condition. This is typically used in the case of a fracture during the emergency or first treatment phase. So initial treatment, or the first time if the patient is taking an active treatment for that particular condition, we will be calling it as a initial encounter. And the example you can see here, fracture of the neck of the femur right leg, initial encounter. Yes, here the complete code and the seventh character will end with an alphabetical word, that is here. Why they have took A? They have specified it has an initial encounter, or they will be mentioning indirectly this is the first treatment, or this is the initial treatment the patient is receiving for the particular condition. If they are specifying in such a way also, you can consider it as initial encounter and you can give the alphabet A in the seventh character. And coming to the second term we will be using in the seventh character, that is nothing but a D. D indicates a subsequent character used when the patient is receiving routine care during the healing or recovery phase of an injury or condition. This may include follow-up visits after the initial encounter. This is commonly used for visits where the injury is healing and focus is on rehabilitation or monitoring the condition. For example, if the patient is coming to the hospital for taking a treatment for the second time, not the first time, not the initial time, for the second time, if the patient is coming to the hospital to take a treatment for the same condition, then we will be calling it as a subsequent encounter. You can see here they have given a simple example, direct statement: fracture of the neck of the femur right leg, subsequent encounter. Yes, a subsequent encounter, they have indicated or they have completed a code with an alphabet called D. Subsequent encounter means yes, I told you again, it will be indicating that the patient visited hospital for the second time to take that treatment for the same diagnosis, or just it is a follow-up visit for that particular condition. And we will be having a sequela here. Sequela used when there are complications or conditions that arise as a result of an injury or illness after the acute phase has resolved. This character is used to indicate the long-term effects of disease or injury, such as scarring and deformities or permanent damage. I can tell you very simply, if any patient is developing a new condition from already cured condition or from already resolved condition. You can see this from already resolved condition. If the patient is developing any new complications or conditions from that resolved conditions, we will be calling it as a sequela. In more detail, we will learn in the upcoming video. Here they have given a simple example or a direct statement. Fracture of the neck of the femur, right leg, sequela they have mentioned, and the code ends with the S character, which will be indicating the sequela. Yes, we'll discuss about this V sequela later. Okay. NEC and NOS. Next, we are going to discuss NEC and NOS. NEC, the abbreviation is nothing but not elsewhere classified. NEC indicates that the condition is known, but there is no more specific code available within the ICD-10-CM to describe it, or used when a condition or disease is described in the documentation, but there is no specific code available for the exact condition within the ICD-10 system. In other words, NEC is used when the condition does not have a unique code. In simple words, if any specification given by a provider and that specification, if it is not finding under that particular main character, we will be giving NEC code. Here I have written inflammatory acne. I'll show you how we will be choosing it as a specified NEC code. I'll be showing in a video. Now I have told an example of inflammatory acne, right? First we'll see acne. If I am mentioning the patient is having acne, then we will be specifying a code called L70.9. Or if I am specifying like the patient is having rodents acne. Under acne, you can find a specification called rodents. What is the code we are having? L70.2. Or if I am mentioning the patient is having a cystic acne, under acne again you can find the specification called cystic. Or if I am mentioning the patient is having a tropica acne, under acne you can find a word called tropica, L70.3. So whatever the specification they have mentioned by a provider, or whatever the specification mentioned by a provider, if you are finding directly under acne, you can give that particular codes. If I am mentioning, I have shown you example has inflammatory acne, right? So under acne, can you find a word of inflammatory? We are having indurata and infantile we are having, but do we have an inflammatory word? Yes, we are not having an inflammatory word. So what we are doing under acne, we will be choosing a word called specified NEC. The code is L70.8. Yes, understood, I hope so. Acne, under acne, if the provider is mentioning any specifications, if that specifications finding under acne subentry, then you can go with that specification codes. If they are not providing that specification under acne, so then in that case you'll be choosing a code called specified NEC, and the code is L70.8. Next, we'll see punctuations. In punctuations, we are having two types of different terms. We'll see one by one. Brackets. You can see the symbol. We'll be calling it as a brackets. If you are finding brackets in a tabular list, we are having two types of list, right? One it is an alphabetical index and one it is tabular list. If you are finding a brackets in a tabular list, we will be calling it as a synonyms. Synonyms, it is nothing but an alternative terms of that particular condition. And if you are finding a brackets, the same brackets if you are finding in an alphabetical index, it will be used to identify as a manifestation code. Manifestation code, it is nothing but a complication. Here we are having an example, Alzheimer's disease. Yes, Alzheimer's disease, it will be if you are leading this particular code, you will be getting two codes. One it is G30.9 and one will be in a brackets, that is nothing but F02.80. I'll show you this particular example through a video. So now, if you are leading Alzheimer's, able to see this, if you are seeing Alzheimer's, beside Alzheimer's we are having a code called G30.9 and in brackets they have documented it as F02.80. So if I am mentioning Alzheimer's, then you have to assign the two codes. This is how
it will be indicating in your alphabetical index.
Now coming to parentheses. Parentheses are used in ICD-10-CM to enclose non-essential information that is helpful in understanding the diagnosis but does not affect the selection of the code, which includes add additional descriptors that don't change the meaning of the diagnosis. So it is, you can simply understand it has wherever, if you are finding parenthesis, that might be in the alphabetical index or that might be in the tabular list. If you are finding this particular parenthesis symbol, and in this parenthesis symbol if they are documenting something, you should consider it as a synonyms. And here I took the example as an hypertension, and in brackets they have given essential word. Able to see, I hope so. So if I am mentioning only hypertension also, you'll be giving the same code. If I am mentioning essential hypertension also, we will be documenting the same code. This I'll be showing in the through a video. You can see that.
So here, beside a hypertension, we are having a different terms like acceleratory, benign, essential, idiopathic, malignant, systemic. So if I am mentioning the patient is having a benign hypertension, also will be giving the same code. Malignant hypertension also will be giving the same code. Systemic hypertension also we will be giving the same code. Like the code will not change. These are just act as a synonyms for a hypertension. So this is an example of the parenthesis.
Yes, these are the points we have been covered in part one conventions. In part two conventions, I'll be cover more guidelines or more rules, whatever we are having under conventions. We'll see in part two. Yes, thank you. For more interesting and updated videos, please like, share, and subscribe our channel. Thank you.